Ashley, tell us about all the different doctors you've been to and all the symptoms you used to have that were destroying your entire life.
So I couldn't go out, do anything. I was in so much pain. And I saw probably a dozen different doctors, and they just told me I was perfectly fine. You know, I have fibromyalgia, take this pill, it'll make you better. And it never did. And so I heard from a friend, kind of a last-ditch effort to come see Dr. Salisbury, and it changed my life. I can go out, do whatever I want with the kids now, walk around, my pain is so much better.
It's incredible. I mean, here you are talking about joint pain, muscle pain, nerve pain. That's pretty much everything.
Yeah.
And you've been to, I mean, how many different doctors?
At least a dozen different specialists.
And any of the medications they give you, what kind of side effects do those carry?
All of them. It changed my personality, the one they gave me for fibromyalgia.
Yeah.
I couldn't work and do my job anymore. It took away all my creativity, all my zest for life.
You got a lot of zest. We love seeing you come in here with all your awesome zest. And so 75% better, and we've just been climbing. I mean, there's more room for improvement, but
it gets better and better every time.
Every single time. Even more recently, the food sensitivity. Tell me how you used to be sensitive to stuff and how that's changed.
So I'm still recovering, still getting better, but it got to the point I lost 35 pounds in just a couple of weeks because I couldn't eat anything.
Oh, that's
when
how
I
it
first
used to
came,
be.
yeah.
Terrible.
And I can eat a lot more now, a lot of different variety of things. I can have vegetables again.
Crazy. Yeah, so what's going on is the gut-brain connection is completely turned off when the neck is twisted so bad, compromising blood flow and cerebral spinal fluid flow, and importantly, when the neck muscles are tight up at the top, that triggers the entire spine to be tight, making it so the brain's really stuck in a fight or flight pattern, meaning like, you know, if you're running or if you're stressed or anxious or nervous, muscles being tight because of a misalignment can actually drive the emotions and the entire nervous system to be stuck in a pattern that's exhibiting stress hormones all the time. And the brain can't really recover under those circumstances. So when we identified the problem, it was 100% obvious, especially with yours, because she's got counter rotation. These more severe cases, many times will have the bones at the top of the neck are twisting in opposite directions. It's easy to see on imaging. We can feel it, we correct it, it gets better. And it's just been a process to go through, but boy, are we glad you've been patient and trusting and followed through with what we've asked you to do.
Thank you.
And thanks for sharing this, because someone's gonna be inspired by this. Isn't that awesome?
I hope so.
Cool, thanks. So this is one of those counter rotation cases where this bone and this bone have twisted towards each other in opposite directions, which is a biomechanical mess. So I'm gonna put my thumb on C1 while I adjust her C2 from right to left. That spinous is gonna be moving this way. And this is providing her a ton of relief with fibromyalgia symptoms, all sorts of stuff. So right here, thumbs here on C1. That just supports it while I move here with C2. Breathe in, chin down. There we go. Good. And then I'll continue to help the C2 on this side by giving it a pull. Breathe in, chin down. There we go. So I use my thumb to get the body of C2 and then pulled it right around. Fantastic. Teeth closed. Breathe. That's a huge sequential release, huh?
Yeah.
Okay, let's trace it all the way up.